Good morning, Jacqueline.
Good morning.
I'm glad that you had some time to spend with me. We are celebrating a huge milestone here at UF Health, right? The 60th anniversary. And I know you've been here a long time, probably as long as I have. How many years have you actually been here?
26.
26 years, 26
Yes,
years.
wonderful years.
I remember when I hired you 26 years ago, I believe, right?
Yes.
As a certified nursing assistant when I was a brand new nurse manager, so you and I have a long history together. So tell me a little bit, what's changed in those 26 years from when you were hired as a PCA on Unit 75 to today?
Me personally, I have grown a lot, a lot. I've had a chance to show my compassion more for patients, for people, for staff, help educate nurses, help educate doctors, help educate anyone that wants to learn more. And they consider my role to be very important, and that to me is a big plus.
Yeah. What is your role now?
Well, for the last 20 years, I was a dialysis technician, certified dialysis technician. In the last 4 months, I became the vascular access coordinator.
Wow.
So as a technician, I was able to teach doctors, teach nurses about what does dialysis do, what does the machine do, how a patient should react, how a patient should feel, and they appreciated that.
Right, right.
So every role is important, from the smallest to the greatest is important.
Absolutely.
They appreciate it.
So you've had a lot of personal growth since you've been here.
Yes, ma'am.
Tell me a little bit about what's changed at UF Health. So 26 years is a long time, right? So.
Yes. The UF itself has changed. At Shands has changed. The building has changed. We've gotten more buildings. We've got a pediatric emergency room. We've expanded the scope of practice. We put up signs so people can easily find their way around Shands without getting lost. And then the diversity in Shands is amazing. Right. And that's a plus, because you get to see people from different cultures, and you get to experience what their culture is all about. And that, to me, I love. I love.
It's changed over the years. It definitely
over the years,
has.
yes.
So tell me, when you think back over the 26 years that you've worked here, what is one of your fondest memories about your experience here, your career here?
Well, one of my fondest memories is when I got rehired here. And that was when you took me around the unit on 74, and you introduced me to people around there. You showed me around. That had never happened to me before. And to me, that you gave me a opening into where I could go. And to me, I took that personally, and you probably never knew this, but I took it personally that I can do anything.
You can.
That I could do anything. And that, to me, when someone takes out, when a manager takes out of their time to escort someone around, not even an employee yet, but escort someone around and show them, that to me tells you this possibly could be you one day.
Right, right.
You know, and I took that and I held on to that for 26 years.
Well, that's wonderful, and look what you've been able to accomplish.
Yes, ma'am.
You have confidence in yourself, and worked hard and got to where you are today.
Yes.
So that's wonderful.
Yes.
I'm proud of you.
Yep. Thank you. Thank you. Thank you.
You know, that's one of the great things I think about working here is that people stay such a long time, right?
They do.
People like you, and you almost become a family, right? Because you all started around the same time, and you see people, you grow up together.
Yes.
You see the changes.
Yes. You know, before I was hired here, I moved to Jacksonville. And I was working up in Jacksonville for a year. And Shands called me after me trying to get into Shands for four times. They called me, and I immediately moved back.
Did you?
I moved back.
Did you?
Yes, because Shands was a great place to work.
Right,
I come from a small town. Everybody go to Ocala games, everybody works at Shands.
Right.
And I wanted to be a part of that.
Right, right.
I wanted to be a part
Well,
of
it
it.
sounds like you made the right choice,
I
because you
did.
sound like you're really happy here.
I am.
And
I am.
you've been able to grow, and you're a great employee. So
Yes. Yes, and you have managers who see your commitment.
Right,
And when you have managers that see your commitment,
right,
they're willing to help you get where you need to be.
right.
And I appreciate that. And it all started with you.
Well,
It did. It did.
well,
Not just because you're
thank you.
interviewing me, because it all started with you.
well, thank you. So, like in terms of the buildings and those kinds of things, I mean, tell me a little bit about how that's kind of changed your role and here and what you think about that growth.
Well, with the buildings, I work in dialysis. So dialysis has an outpatient clinic,
Right.
and they also have an inpatient
Right.
pediatric clinic
Right.
also,
Right.
acute and pediatric,
Do you work in both of those areas, both of them?
both of them. And so now in the Heart and Vascular Hospital, we have another clinic over there.
Right.
So it's expanding to give more convenience for dialysis and for
Right.
patients who need it.
So the patients from those hospitals are dialyzed in that area versus
Correct.
having to.
Right.
I remember when we first started, it's just one small unit,
One
right?
small
And
unit,
had to
11
come-
spaces.
Right,
Yeah.
right. That's a lot of growth.
It is.
A lot
it
of
is.
opportunity to help patients and
Yes.
take care of more patients more efficiently, right?
Right. In the organization that we have, you have Health Shands in Gainesville. I am the only dialysis technician.
Wow, that's great.
So I feel proud.
You should
I
be.
feel proud to
You
be a
should
part
be.
of it.
You should be.
I really do.
That's wonderful.
It is.
Congratulations.
It is. I love my job. I love my work. I do.
Congratulations. And I'm sure the patients love you.
Oh my gosh. Oh my gosh. They call me at home. They call me, Jackie, I need this. I need help. But yeah, it helps me to help them.
Right.
You know,
That's rewarding.
when you're on dialysis, you want to come into an environment where you have to come,
Right.
but it can be an environment where you don't mind coming.
Right.
And that's the kind of environment that we like to offer.
Yeah. And that's special. That's really special.